Hello, my name is Courtney, and for the purpose of this assignment, I am acting as a counselling psychologist together with Leanne, acting as an educational and developmental psychologist, and Michelle, who is acting as a health psychologist. We are looking at burnout in teachers over the age of 55. Although Leanne has already described burnout, I will do the same, and I will then address how burnout affects teachers. I will explain the approach of a counselling psychologist and the theories that they may utilise. I will also speak about the common triggers that are developing burnout in teachers, and I will speak about how a counselling psychologist might address these. Burnout can be described as a chronic response to cumulative, long-term negative impact of work stress. Burnout is especially common in any individual who works with other people in some capacity, and for teachers, it is especially common in those who have been in the profession for an extensive amount of time, or for those who are nearing retirement. Burnout is often seen in three phases: emotional exhaustion, depersonalization, and a lack of satisfaction in one's achievements. Teaching has been identified as a relatively stressful occupation, one in which burnout is very common. Among teachers, burnout is said to be one of the leading causes of retirement and/or change in career. Teachers who become burnt out may be less sympathetic towards students. They may have a lower tolerance for frustration in the classroom. They might plan for their classes less often or less carefully. They may fantasize about or actually plan on leaving the profession. They may also feel anxious, irritable, depressed, and they may feel less committed to and dedicated to their work. Leanne has identified that teachers are becoming burnt out due to having an increased stress over classroom management and an increased workload. Also, she identified that many teachers are experiencing a lacking sense of personal achievement and that there is a large demand for training programs in order to build teacher self-efficacy. As a counselling psychologist, my work is concerned with the control and regulation of an individual's feelings. Therefore, in this scenario, I will focus on identifying and treating two main causes of burnout in teachers over 55, those being stress and anxiety. Using common and generalised examples, I will shed light on the common triggers of stress and anxiety and how I, as a counselling psychologist, will help those suffering from burnout. I will mainly do this by adopting a person-centred approach that will allow the person to feel in control of their choices. Through the process, I will be able to guide and facilitate for the person while they discover and identify effective ways to deal with and manage the stresses in their life. Following on from Leanne's findings, I have identified that many teachers at this time in their career experience anxiety due to a lacking sense of community in their school environment. A factor commonly attributed to this lacking sense is a lack of social support and the disconnect with fellow teachers, sometimes due to the overwhelming amount of younger graduate teachers entering the workforce. This is not only in terms of physical age and social differences, but also due to the changes in teaching styles and a push towards a modern-day classroom and online learning. This disconnect is becoming an issue because older teachers are missing the social support from colleagues and the opportunity to discuss and work through the challenges they are facing. As a counselling psychologist, I would use a person-centred approach to assist teachers to identify their other available forms of social support. This could be formal support in terms of other health professionals or professionals within the school, or it could be informal support like family members and friends. Research shows that social support and talking about stresses is one of the most effective ways to reduce emotional exhaustion, which has been seen as one of the leading causes of burnout. More general ways to assist with stress and anxiety could be identifying external factors of someone's life, for example, eating, sleeping, and exercise patterns. A stable sleep pattern, a healthy diet, and regular physical activity are all factors that can assist with the reduction of stress and anxiety. And in this scenario, it could be used to assist the older teachers to better manage the stresses that come with being in a modern-day workforce. Many teachers also face the disconnect with their students. With the rapid changes in technology and the ongoing syllabus changes, older teachers have identified that they are losing their passion for teaching because they are unable to connect with each student on a personal level. If teachers are losing their passion, I could adopt the person-centred approach in order to assist them with planning for the future and identifying some goals. Firstly, I would learn their feelings towards retirement. Retirement can be very complex for some teachers because there are many factors to weigh up. These include financial struggles, loss of identity, and the prospects of what to do with their lives after work. It is first important for me to learn whether a person in this situation wants to retire. If so, then as a counselling psychologist, I could assist them to develop a proactive plan in which they are in control of. Some teachers might choose to go part-time as a way to transition into retirement and not feel as though they are being forced out of something they truly love. At the risk of losing their identity, teachers often feel anxious about retirement, and therefore they believe they will lose their passion for helping and contributing to someone else's life. If this was the case, I would be able to assist them in identifying other avenues to fulfill these passions. Some may choose to do tutoring or volunteering. Using the person-centered approach will allow the person to feel in control of their choices and give them a sense of accomplishment in creating their own journey. On the other hand, if a person was to identify they don't want to retire, then I could assist them in reigniting their passion by finding the reasons they became a teacher in the first place and helping them to make proactive steps toward enjoying their role once again. Again, a person-centered approach could be used here in order to recreate self-confidence in the person and also to recreate an identity and sense of belonging among their workplace. Reflection is also an effective way to develop a sense of accomplishment, as it will help the person identify major milestones in their life, and it will assist them to visualize how they have made a positive difference in people's lives. Challenges will arise if I identify that a person feels they would like to retire, but for some reason can't. Usually this is financial. As a counselling psychologist, I would need to work through this with someone to reduce their risk of developing depression. If a person continues being stressed and anxious, the burnout will only increase and depression is almost inevitable. In this situation, I would prompt the person to discover some alternative avenues. This, for example, could be the option of changing careers. However, at 55 years old or older, this is not always something that people are open to. It could also lead them to investigate other financial options, like superannuation, or it could guide them to inquire about different job opportunities in their current workplace. In order to do this effectively, a person would need to utilize the social supports discussed earlier, so they are able to talk through their options and reduce the feeling of being burdened. Ultimately, the goal when dealing with cases of burnout is to reduce the risk of developing depression by identifying and managing the causes of the burnout, which in this case is stress and anxiety. If this is not done effectively, there can be major health implications. Michelle will now go on to talk about the risks to health of someone who does not effectively manage the stress and anxiety and how detrimental burnout and potentially depression can be to one's health. Thank you.